Sciatica, also known as lumbar radiculopathy, refers to pain and other symptoms which radiate throughout the sciatica nerve. The sciatica nerve is the main nerve that branches out from the lower back and travels through the hip, buttocks, and down the legs. In sciatica, the roots of the sciatica nerve running from L4 to S3 become compressed by a herniated disc or narrowing of the spinal canal. This can cause radiating pain, weakness, and numbness through the hips and legs. Sciatica, which lasts for 8 weeks or less, is known as acute sciatica, and more than 8 weeks known as chronic sciatica. Several different conditions can result in the compression and irritation of the sciatica nerve, causing symptoms of sciatica. Some conditions include disc degeneration, spondylolisthesis, piriformis syndrome, herniated disc, lumbar stenosis. Here I am going to present a research by World Journal of Pharmaceutical Research on the efficacy of yogasana in the management of sciatica, which is known as in Ayurveda Grudrasi. This research says that 1.6% in the general population to 43% in a selected working population reported the sciatica symptoms. These sciatica symptoms have close resemblance with Grudrasi mentioned in the Ayurvedic classics as a type of Vata Vyadhi, wherein the pain along with stiffness, gripping and palpitations start in the buttocks, that is gluteal region, and gradually encroach the posterior aspect of Kati, that is pelvis and lumbosacral regions, Uru, thigh, Janu, behind the knee, Jangha, leg, and Pada, foot in sequence. Pain in the sciatic distribution of sciatica nerve due to inflammation is typical disorder of Vata vitiation. The research further says patients suffering from Grudrasi generally approach to a physician for a safe, effective, and alternative solution for this chronic ailment. Whereas yoga therapy is a holistic system of therapy in which yogic practices are used to prevent and treat not only the ailments of the body but also the mind. This therapy prescribes specific regimens, postures, breathing exercise, and relaxation technique to suit individual needs. According to Yoga Shastra, practice of asana removes pain. Ardha Matsendrasana asana and Pavan Muktasana are important asana described in ancient texts are effective in relieving pain. Hence, an attempt was made to study the combined effect of these two asanas in Grudrasi. Method. Total time for this procedure was approximately 15-20 minutes. Included warm-up exercise and Omkara chanting. Procedure for asana was 15 minutes. Stepwise procedure of asana, 10 rounds, was carried out as per the textual references. No other medication was given during the trial period. The duration of the treatment was 30 days. Study was continued for post-treatment follow-up to total 45 days from commencing of the study. Now here is the detailed discussion that when sciatica develops, it is usually because sciatica nerve roots have been compressed in some way. The pathology involves piriformis muscle since the fibers of the muscles more or less cushion part of the sciatica nerve. When there is tension in the muscle, it compresses the nerve, which might lead to its characteristic sciatica nerve pain. Both Ardha Matsyendrasana and Pavan Muktasana relieves sciatica nerve pain because it helps in strengthening the area surrounding the sciatica nerve without causing pain. It stretches the muscles of the lower back and piriformis while boosting the blood circulation within the lower back area. The muscular and skeletal tension in any part of the body directly affects the Shrota systems or circulatory channels in our body by creating obstacles for carrying toxins from our body. Asanas with the effect of relieving tension from muscles and bones make the Shrotas function more smoothly. These two asanas increases the elasticity of the spine, tones the nerves and improves the functioning of the spinal cord, relieves the back pain and stiffness from between the vertebrae, massages the abdominal organs and increases the digestive juices, making it useful for loss of appetite and constipation. Pavan Muktasan helps to remove excess fat from the abdomen and thighs, enhances blood circulation in the pelvic region. Continuous practice of Ardha Matsyendrasana and Pavan Muktasan correct the spinal alignment, postural defects, and stiffness of muscles. Collective effect of Vata Shaman, Asti, and Mamsa Dhatu Pushti relieves symptoms of Growth Rasi, that is sciatica. In conclusion, the research says that asana have a far-reaching effect on body and mind, which are attained through regular practice. So these two asanas are important asana, which has described in ancient text, and as effective in relieving pain. These are very easy to practice and they relax not only the superficial but also the deep muscles, which also have major role in lower back pain. This asana tones the pelvic muscles and relaxes the leg muscles and relieves sciatica pain. Compression on the legs during Pavan Mukta Asana can reduce varicose veins. At the same time, Ardha Matsyendrasana Asana removes stiffness and pain in the hip joints and lower extremities. So these both asanas are beneficial in the management of Growth Rasi, helping in relieving the symptoms of disease condition without causing any harmful effects on the body. Hari Om.